Hello, dear friends. My name is Sofia Dorinskaya. I am a doctor, and today we are going to talk about very insidious conditions of nutrient deficiencies. They are insidious because their symptoms are not obvious. These symptoms are quite subtle. They are common, these symptoms, for people. And the only way you can identify these symptoms is by being aware of them. And today, we are going to talk about the subtle deficiency of vitamin C, how it manifests, why it isn't obvious, how you can suspect it, and what you can do about it. So, Professors Lepsky say that reduced levels of vitamin C, or hypovitaminosis, have very subtle symptoms. What does that mean? It means that a person already has a deficiency. They are already suffering from it, from the lack of this vitamin, but there are very few symptoms. Moreover, these symptoms are masked by diseases that develop due to this existing vitamin C deficiency. And this is the state of deficiency. I'm just going through his text right now and translating it for you from medical language to everyday language. And this state of hypovitaminosis doesn't always quickly turn into full-blown scurvy. Moreover, for some reason, there is currently a belief that there are no nutrient deficiencies. And as for scurvy, especially when we actually see it, especially dentists see clear signs of scurvy, they don't identify them. Clear signs of scurvy, bleeding gums, loose teeth, mouth ulcers. These are all obvious symptoms of scurvy. But doctors don't know and have the false impression that deficiencies no longer exist, so they don't recognize it. As Lepsky writes, sometimes entire epidemics, in quotes, diseases affecting large groups of people living under the same conditions, can remain at this stage of hypovitaminosis. What does that mean? It means that people who live in the same area, who have roughly the same diet, since the same products are delivered to their stores, all feel more or less the same. They might think that in this particular area it's normal, but in reality, it's a sign of vitamin C deficiency. What am I talking about? So what do people complain about? About fatigue, loss of appetite, shortness of breath, and heart palpitations. Sometimes there is an unexplained appearance of red blood cells in the urine. So you went to get a urine test and it's basically normal, but there are 1 to 2 red blood cells per field of view. And the doctor looks and thinks, well, what could it be? Well, weakness, shortness of breath, sometimes heart palpitations, my appetite is reduced. 1 to 2 red blood cells per field of view. Get some rest, yes. What else? Increased capillary fragility. I don't recall bumping into anything, but I have a bruise here. Is this something catastrophic? No, well, if you look at it separately, well, you're tired. Well, shortness of breath. Go to the gym, right? Do you exercise? Do you do any physical activity? No? Then why don't you have any energy? Well, that's why you have shortness of breath, you see. But in reality, it's a very serious condition. It's a very serious condition. Your body is already in a chronically diseased state due to a vitamin C deficiency. And most importantly, it's very good to observe and notice these early signs of deficiencies because their continuation actually leads to serious disease states, which can develop into severe secondary pathologies. Let me remind you that tuberculosis, for example, is fundamentally based on a vitamin C deficiency. And by the way, that's exactly why, since nowadays doctors are no longer taught this information about vitamins and the manifestations of vitamin deficiencies, since they aren't taught this, even pediatricians who treat tuberculosis don't know about it. They just load people up with specific therapy, but they never address or remove the underlying cause of nutrient deficiencies. That's why we now have tuberculosis spreading that they can't cure, you see? That's why. The use of recommendations regarding vitamin C, it will simply save you from a lot of problems, from a lot of diseases that can develop, both as secondary to vitamin C deficiency and as secondary even to reduced levels of vitamin C in your body. I highly recommend to you not just the efforts and knowledge we've shared here, I really strongly recommend it. And please, make use of these recommendations. Thank you very much for your attention. All the best. Goodbye. The link to the website is below the video. Thank you.